House Bill 4002 gave law enforcement the tools to stop drugs coming into our communities. It also gave us the path to make sure that people who are addicted and possess a personal amount of drugs have a pathway to recovery and services. We have heard the need for a deflection program from community members and partners, and we've been given a clear mandate from our state legislature to prioritize this program in response to House Bill 4002 and to make sure that Multnomah County is ready to respond. There has been criticism about not having a plan, but we are building a deflection system that includes mobile outreach, leverages peer support, and finally creates a drop-off center for law enforcement. I am standing here today with a building, with a provider, a good neighbor committee, security, transportation, and a clear understanding about what deflection is. I am thrilled that our provider, Turk House, is on the ground in Portland and is here with us today. They have a record of nearly 50 years of this work, and I'm so glad for this opportunity today for you to hear from their CEO. These are seasoned providers. They will be ready on day one as they join this broader coalition committed to connecting people with treatment first, before jail, so that more people struggling with addictions are likely to recover, heal, and thrive. Today, these partners stand together to talk through what we're creating and what the impacts will be on our community. We already know many of these impacts because we know that treatment is the best route to recovery, that we must have a path to services for people who interact with law enforcement, that getting people connected to care and services must be our focus, and keeping people who need care out of jail will make our community stronger and safer. We are working diligently to make sure there are real paths for people possessing a personal amount of drugs away from our criminal justice system and towards healing, housing, and health. I look forward to our continued partnership to do just that. And now I'd like to welcome Police Chief Bob Day to the podium to talk about how the Portland Police Bureau is preparing for September 1st.
Thank you, Chair. Good morning. One of our founding fathers, Benjamin Franklin, once said, "If we all think alike, no one is thinking." And I understand the frustration and the apparent disconnect and misunderstanding that has come across maybe in this process. And I'm just speaking from a guy from the inside. So it's not lost on me, some of those challenges. But these are complex issues, and I really appreciate everybody's efforts in trying to weigh in to find a solution, a starting point. As we are speaking right now, the operational teams for the Multnomah County Sheriff's Office, Gresham PD, and Portland PD are meeting to begin thinking of ways and strategizing ways to be able to operationalize this deflection program. It was critical that we got something started for our membership, recognizing that there are still going to be times ahead where we can evaluate its effectiveness, success, etc. Three primary things I want to share with you. One, who's eligible for deflection? Under this agreement, individuals stopped by law enforcement are eligible for deflection if they possess illegal drugs for personal use. There's an extensive list about what personal use means. I would encourage you, I think Mike Benner has those if need be. They are not committing any other crimes, and they have not failed deflection within the prior 30 days. If they're on parole or probation or supervision, they're still eligible for deflection, but their supervisors will be notified and kept in the loop of what's going on. What does successful deflection look like? And we agree that, for starters, an individual has successfully engaged in deflection if they have completed all of the following: a screening, received a service referral, and engaged with referred service as recommended by the screening within 30 days. We believe that 30-day window gives them ample opportunity to try and take some responsibility for themselves, as well as we understand the complicated network that they may be trying to navigate. We want to make sure that happens within those 30 days. What are some of the limitations of deflection as we've currently structured it? If an individual fails any of the above steps, they will not be eligible for deflection for the following 30 days and would instead be arrested and charged if contacted by law enforcement during that time period. So there are some accountability standards put in there in terms of their requirement of their participation. If they're contacted and they haven't engaged, then we will move towards arrest or citation. I'm going to pass it off to Sheriff Morrissey O'Donnell for her remarks.
Thank you, Chief Day. I'm Nicole Morrissey O'Donnell, Multnomah County Sheriff. Today I'll be speaking with you about our shared commitment to reviewing data every 30 days, the experience of individuals and providers, and our public safety needs. We understand the grave importance of data-driven decision-making, and it is also important to recognize that this framework for deflection was developed with what we are currently experiencing today. And the communities that each of us serves in are drastically different, and they look different than 5 years ago with respect to the public safety needs and the additional behavioral health challenges. Our review will include, but it will not be limited to, analyzing the date and location of each contact, demographic information, the connections that were provided to engage with treatment and/or additional services, and the outcomes of those referrals, the experience of individuals involved in the deflection process and those of the service partners, utilizing practices developed in partnership with our health department and the provider to gather this feedback. We'll be looking at tracking both behavioral health outcomes as well as support provided to the individuals and their thoughts on the ways that support is helping them take the next steps, and our collective public safety needs. Our three agencies are working together to align our operational efforts, as mentioned by Chief Day. We'll be tracking what officers and deputies are seeing in our community when deflection is utilized over entering the criminal justice system, as well as how often individuals engage in the required next steps as defined by their screening. Having these 30-day reviews will allow us to critically evaluate what is working and allow vast opportunity to adjust along the way. Accountability for individuals entering deflection is a shared responsibility of this group. In our 30-day reviews, I am hopeful that we can identify the services that are missing from this initial framework and utilize our criminal justice system when it is needed. I do appreciate the collaborative work that is happening and ongoing with this group. Providing a path to deflection gives law enforcement another tool to help people in crisis get the resources and services that they desperately need, and also provides a pathway away from the criminal justice system when it's appropriate. Thank you very much, and I would like to now turn it over to District Attorney Mike Schmidt.
Thank you, Sheriff. I'm District Attorney Mike Schmidt. Thanks to the chair, the sheriff, the chief. I appreciate our collaboration and partnership that we've had in developing this program thus far. I want to emphasize this is a new program, and we're building it from scratch. We've already made adjustments to our plan, taking into consideration the feedback we've received from stakeholders, and that's a good thing. This is an iterative process, and I think that's exactly how it should work, evolving over time. What we have now, I believe, is a program that meets the intent of House Bill 4002, that we can treat addiction like the health issue that it is, while also holding people accountable for their actions and how they impact our community. I've heard from law enforcement that what they really want, what they really need, is somewhere to take people suffering acutely from the impacts of addiction. I've heard from community members that they're tired of seeing people use drugs openly on our streets and in plain sight, and I've heard from others that they want to prioritize treatment rather than jail for people suffering from addiction. I empathize with all of that. And come September 1st, I think we're taking a step in the right direction of addressing those concerns. We all recognize that addiction and recovery is not a one transaction exchange. Because of the nature, it will require multiple attempts at treatment. That's why if deflection fails, conditional discharge is built into the criminal prosecution process in House Bill 4002. We want to allow multiple opportunities to get people connected with treatment while still maintaining accountability. The bottom line is law enforcement needs tools to stop behavior that harms the community, and the goal needs to be to connect people with treatment, not incarceration. And I think this program works towards those goals. So with that, I'm going to turn it over to Bernard Gaby Foster, the Executive Director of Turk House.
Good morning. My name is Bernard J. Foster, and I'm the CEO of Turk House, Inc., a substance use treatment facility from Baltimore City, Maryland. Turk House is a nonprofit drug and alcohol system that was created in 1970. Over those 50 years, we have grown to see over 70,000 patients across our various continuum of care facilities. We are extremely proud of the treatment model that we have in Baltimore, and we are hoping that we can also replicate that same sort of system of care over here in Multnomah County, Portland. In fiscal year 24, Turk House provided care for nearly 11,000 patients in the greater Baltimore community. Out of those 11,000, 80% of the patients were deflected from the emergency department services. Out of those 4,068% were able to stay sober for a good 30 days. And out of that 60%, a good 40% were able to maintain sobriety for a year. Among our most significant accomplishments was the creation of the Maryland Crisis Stabilization Center and the Crisis Sobering Services in 2018 to help divert overdose-related patients from the emergency services. Our goal here is really to collaborate with the county, with various stakeholders who are behind me, law enforcement, to be able to direct patients to the deflection center and hope they are able to receive services and stay engaged in treatment. We want to thank the chair of the board, Chair Peterson, and the rest of her team in welcoming us to Portland. Our hope is to collaborate. It's going to be an assiduous process. It's not going to be a one-day event, and so we are hoping that come September 1, we'll be able to open the deflection center and welcome patients who are in dire straits and are in need of services. Once again, we just want to thank everyone involved, and we hope to continue collaborating as we move forward. Thank you so much.
Thank you, Bernard. And with that, we have time for a few questions. Please state your name, which outlet you're with, and who your question is addressed to. And we'll start with Ezra.
Ezra with KPTV, and this is for Sheriff O'Donnell. So Sheriff, yesterday there was some disagreement and some confusion between Mayor Wheeler's office and your office. We heard somewhat of a disconnect of booking people who are arrested for daytime camping bans. Have you been in touch with Mayor Wheeler since yesterday?
First, I want to reiterate that I want to respect everyone's time with respect to 4002. Our statements that were provided over the last couple of days stand for themselves, and I will always be a collaborative partner with the Portland Police Bureau and the City of Portland as we navigate extremely challenging times with respect to public safety and developing the best outcomes for all of our community and the safety of our community.
And you said in your statement that you weren't going to be booking anybody on city ordinance violations. Do you stand by that still?
At this point, I'm standing by that statement in anticipation of having an opportunity to have further conversations with our public safety leaders and the City of Portland to again determine the best pathways forward to support community safety in all of our communities.
Next up, Blair.
Yeah, Blair with KGW. My question is for Chief Bob Day. How do officers plan to keep track of the timeline of each person who would potentially violate deflection and then need arrest? The 30 days is what I'm referring to.
Yeah, the timeline piece is definitely part of the conversation. You know, we'll be looking for the county and deflection coordinator to be able to provide that real-time information. We'll probably, I'm speculating now, but we'll probably be relying upon our current communication systems, whether that be through the MDCs, the computers in the cars, so that when we run somebody, it'll come up and say, hey, here's the information, you know, here's the dates, etc. This is not uncommon practice in other areas, but it will be incumbent upon the county to be able to provide that in regular real time so we can have that accurate information.
Lisa.
Just a follow-up for Chief Day for a moment. Chief, on September 1st, are we going to see officers shut down open drug use on corporate streets?
Yeah, so the question is, on September 1st, are we going to see officers shut down open drug use on city streets? I would hope that we always will use our discretion when we're enforcing the law. So to just say that there's a blanket policy around that would not be appropriate at this time, but I will be relying upon and expecting our members to be engaging in enforcement around this new law. So in the past, as you've known, we have been interdicting with Measure 110 resources, issuing citations and connecting people with services. And now with the change, yes, I anticipate there to be arrests, but I also anticipate a reliance upon the deflection center. We have to settle into this thing and give it an opportunity to work. And so that's going to be my message in the organization. Yes, to take action. Yes, to participate in the deflection center.
Isn't that part of the situation with the 4002 to shut down open use? In other words, in any way, shape, or form, to stop open drug use on the streets?
Yeah, we will be addressing open drug use on the street. And we've been doing that under 110, and we're now going to be doing that under 4002. And under 4002, we'll be taking people in custody, and we'll be taking them to the deflection center. If they're not eligible for deflection, then we'll be taking them to jail.
Do you have any idea how many people at a time you can do?
No, at this time, I don't know what the numbers will be.
Max.
Thank you. I don't know who can answer this, whoever. One of the criteria is that people engage with a service provider. What does that mean? What is engage? And then the other question is, what will be the hours of the deflection center come September 1st? And will there be any transportation service?
Yeah. So thank you, Maxine. I want to make sure because there were several questions in there. So I'm sorry.
The first one was engage. What is engage?
Yeah. So it was really important for all of us standing here, as well as the other folks who have been a part of the 4002 conversations, that there is accountability for people in engaging with services. The legislature in House Bill 4002 was expansive in what constitutes deflection, which it includes recovery and treatment services, housing services, and other services. So what we are saying is that whatever that individual pathway for that person looks like, what they need to be on the next step, that they need to abide by that next step. They need to engage in that next step, and they need to do so in 30 days. So that could be going into housing, that could be getting into detox, that could be getting into their treatment bed. They need to positively engage in that, and that is something that we are going to be tracking. When the sheriff was talking about the data, one of the pieces of data is the date that they engage in those services. That is information that we are going to be tracking, so we know affirmatively that whether they did or did not engage in services.
So is that just like meet with the provider, or do they have to like start treatment?
Yeah, that's a really good question, and it's going to depend on what that service plan looked like for that person. We now, as as you've heard, we have Turk House engaged as the provider for the deflection center. We also have other partners who are working with us on the broader deflection system. So something that could potentially look like what we're seeing from the police and the provider that's happening downtown. Those are also another path for deflection. But that's really going to depend on what the next step for that person, that individual is, as a result of their engagement with the peer and with the provider.
My other questions
Okay.
were on the
Yes, and so
the hours of.
Yeah, so again, we have Turk House on board. They're going to be working with our health department as well as other providers to really nail down some of those details, and I want to make sure they have the space to work and to have those conversations. I will say that our goal and the county's goal in the deflection center and moving into sobering is to have a 24/7 drop-off center available for law enforcement. So that is the ultimate goal that we are going to be working for. And security and transportation will be a part of the deflection center.
Emily.
I have a follow-up question for the sheriff. Sheriff, the mayor said in a statement yesterday that you lifted booking restrictions in August 2023 during conversations about this camping ordinance. Is that true?
So I think that everything has been said about that topic today.
I needed an
If you'd
answer
like,
to this question because there's a disconnect
keep the focus
here.
on House Bill 4002
You're not going to. It's a yes or no question. It's a yes or no question.
I think the sheriff has said what she needs to say. Christina, did you want to ask a question?
Yeah, where are the city officials today, and
Well, because the police chief is represented here, would you like to answer that question?
Well, we do have Stephanie Howard here from the mayor's office. Thank you, Stephanie. And I am representing the city officials. I've spoken with the mayor recently. I've spoken with Commissioner Gonzalez recently. Spoke with Commissioner Rubio's office earlier this week. So I feel very supported. We feel like we have some clear direction. We had to get this plane on the ground. As I mentioned, for the men and women that are actually being tasked with doing this work September 1st, we really owe it to them to be able to give them some clarity and some direction. So I feel confident that we're in that space. Tell me what it'll look like on September 1st, September 15th, October 1st. We'll probably be back here having a discussion about that. But for right now, I feel really comfortable that the city's aligned with where we're trying to go with this.
How will you transport people to the deflection center? Under what legal authority will you?
Well, they'll be under arrest, so they'll be in custody. So we can take them to the deflection center. We can take them to jail, wherever we need to, wherever we need to transport them to.
The deflection program application says you will not be issuing citations, but you will be arresting people?
Correct. If somebody's taken into custody, let's break this down. If somebody's taken into custody, they're under arrest. So whether they're issued a citation or not, we can unarrest people. You can take somebody into custody and then decide, based upon the evidence, the information, to unarrest them and have them walk away, not just in relation to this incident, anything at all. So when I say that they'll be under arrest, they'll be taken into custody, and then we'll be taken to the deflection center. The officers are still going to be writing reports. We're still going to be collecting evidence. We're going to be doing all of this as if it were somebody that was going to jail. So there'll be documentation of all that, and then the county will collect the information and the data and then share that with us down the road.
Are there other crimes that you're doing this for currently, other instances that you can give examples of, or this would be unique?
Excuse me, other crimes that we're
Like,
doing what for?
where you're arresting somebody but not citing them and then letting them go. Like, how does this work with other crimes? Is this a unique situation?
Well, I don't have any examples off the top of my head. I mean, discretion is a significant part of our role in enforcing the law, so I'd be speculating at this point. I can get more information on that. Mike and I can talk about it and see.
We have time for one question from somebody who hasn't asked. Joelle, would you like to go?
With respect to the mayor, my question is about the household force reserve too. But the mayor's statement yesterday said he's concerned with this disconnect into the enforcement of household force reserve too. I just wanted to offer your chance to respond.
Again, I remain committed to working with our public safety partners, all of our service providers, to ensure that we are operational and moving forward on September 1st, and that we are continuing to evaluate our progress, any gaps, and that we are also continuing to modify this system to ensure that it is serving the needs of our community and supporting public safety.
Sheriff, if you have a different story than the mayor, how can
Hey,
the public trust that the city and the
for,
county are working together?
So we're going to have
Can you
opportunities
answer
to
that?
follow up directly with the public information officers who are here today. So thank you all for your time. I'm Ryan Yambra with the Multnomah County Communications Office, and we also have Christina Kempster with the Sheriff's Office, Liz Mera with the District Attorney's Office, and Mike Benner with Portland Police Bureau. We'll be sticking around, and if you'd like to route anything through us, you may. And with that, thank you.
How can you not answer this question?
Opened in 2018. I just wondered how many beds. Was that strictly sobering? Or
Yeah, there-
thank you.
Yeah. Did you think that was too aggressive? So yes. So yes.
I was afraid of having a place to park, so it's like